New York State Governor Andrew Cuomo has announced New York State is doubling its testing capacity, reaching 40,000 diagnostic tests per day and launching a website for New Yorkers to find nearest COVID-19 testing site. The governor also announced a state partnership with CVS pharmacies to begin testing in more than 60 locations statewide. Each pharmacy will have a capacity for at least 50 tests a day. The state's diagnostic testing criteria now includes all individuals who return to the workplace in phase 1 of the state's reopening plan. New Yorkers eligible for diagnostic testing now include any individual who has COVID-19 symptoms, any individual who has not had contact with a person known to be positive with COVID-19, any individual who is subject to a precautionary or mandatory quarantine, or any individual who is employed as a healthcare worker, nursing home worker, or first responder, and any essential worker who directly interacts with the public while working, and any individual who would return to the workplace in phase 1 of the state's reopening plan. Well, moving on from the state to New York City Mayor Bill de Blasio announced CityMD will provide free coronavirus tests to uninsured New Yorkers as part of a partnership with New York City aimed at getting tens of thousands of people tested every day. Well, the urgent care company is offering testing at each of its 123 walk-in sites in the area with a capacity of 6,000 PCR swabs per day at its locations. The move puts the city ahead of their goal to be offered 20,000 tests every day by May 25th. Mayor Bill de Blasio stated, "We have now hit the goal a week early. We're at capacity now, and we're going to keep growing." Well, in MTA news, the MTA suspends overnight subway service. Many homeless New Yorkers are left on the street or actually congregating in shelters. Our own Bronx Net reporter, Kibin Aline, brings us more details on this story.
In an effort to protect public health amid the COVID-19 outbreak, Mayor de Blasio and the MTA have suspended overnight subway service for a scheduled daily cleaning. The scheduled 1 a.m. to 5 a.m. shutdown is now sparking conversation on the way New York City is addressing one of their most vulnerable populations, the homeless.
A few weeks ago, the mayor and the governor announced that they had decided to shut down the subways overnight. And we immediately were concerned about the thousands of homeless New Yorkers who bed down in the subway system as a means of survival. No one's really been able to answer where homeless New Yorkers are supposed to go.
Since the outbreak, New York City Public Transit has seen an increase of homeless individuals seeking refuge. Policy analyst for the Coalition for the Homeless, Jacqueline Simone, explains why some homeless New Yorkers are seeking shelter within the mass transit system.
Many people are on the subways largely because they do not feel safe in the congregate shelters, particularly when we have a deadly virus spreading in the shelters. Many people do not feel safe there.
In an attempt to clear out subways and assist the homeless, Mayor de Blasio announced the progress of a new initiative in collaboration with the MTA, an initiative he says is currently working.
Last night, when the subway shut down for cleaning, our homeless outreach workers and specially trained members of NYPD were out there to help homeless New Yorkers, to offer them a chance to come in and get support. 261 homeless individuals were engaged. 139 of them accepted help. 116 went to shelter, 23 went to hospitals.
But Simone responds the offering of placement at congregate shelters can cause more harm than good, due to overcrowding through shared living, eating, and hygiene spaces. She also reveals the complex issues facing these New Yorkers when met with a decision to accept or decline help.
People are being asked, do you want to go to a shelter? And again, many times people have gone to the shelter system and found it did not meet their needs. Or if someone accepts the offer and then they're taken to a large intake site and that's not being communicated to them what the process is, you can understand why someone might just walk away.
In the midst of a public health crisis, the Coalition for the Homeless says their top priority is making sure homeless New Yorkers have the same protection as anyone else, but expresses that starts with having communication with this vulnerable population.
I think this is really indicative of this overall failure to engage homeless New Yorkers and asking them what they actually want and need.
The Coalition for the Homeless is encouraging the city to offer homeless New Yorkers single-occupancy hotel rooms to facilitate appropriate social distancing and self-care. In the meantime, Simone shares they will continue their efforts to provide basic supplies and essential resources for this community. Reporting for BronxNet, Kibin Aline.
And thank you, Kibben. Bronx that will continue its coverage regarding the coronavirus pandemic and more when Open continues right after this.